Biologic agents. Biologic agents are exploding in the market. Tons of new drugs are coming out, so I find understanding the nomenclature to be very helpful. All drugs that end in MAB are named so to tell us that they are monoclonal antibodies, used to target overexpressed cell surface receptors. The first substem is called the source substem and tells us where we got this monoclonal antibody from. In this case, the XI tells us that it is a chimera or a cross between species, for example, a human and mouse. The substem before that is called the target substem and tells us what our monoclonal antibody is targeting. So in this example, the TU in rituximab tells us it's targeting a tumor. If you Google monoclonal antibody nomenclature, there are some very helpful charts that help me learn these drugs in a more efficient way than trying to memorize them individually. All the drugs that end in IB are small molecule inhibitors that target intracellular molecules. A high-yield one is imatinib. Do you remember when we use imatinib? In patients with chronic myelogenous leukemia. Imatinib is a tyrosine kinase inhibitor of BCR-ABL, the Philadelphia chromosome fusion gene seen in CML. What's the difference between etanercept and infliximab? They are both TNF-alpha inhibitors, but etanercept works as a decoy receptor for TNF-alpha, aka it is a receptor fusion protein. Infliximab, as you notice from its suffix, is a monoclonal antibody that binds TNF-alpha. And the last category listed are the interleukin receptor modulators that conveniently have kin in their name.